Hello everyone, welcome back to my channel. Today this video is for the nurses and the topic is maternity and child nursing. So let's begin this practice test. There are 30 MCQs in this practice test. Here is a question number 1. What I will do, I will read the question and you can read the question option. Then I will give you the correct answer and then you can compare your selection with the correct answer. I will also provide you the rationale for each question. Question number 1. Which hormone is responsible for stimulating uterine contraction during labor? Pause the video for 5 to 10 seconds and select the best choice you think. Here in this situation, the correct option is option B. And why? The rationale is oxytocin stimulates strong uterine contraction during labor, essential for fetal descent and labor progression. Let's move to question number 2. Question number 2. Which fetal position is considered ideal for vaginal delivery? Read the 4 options. The key is here. The tips or strategy is here. Read the question, highlight the keywords in the question, and then read the 4 options. Okay, and do elimination. Always compare your practical. Always think like apply your practical knowledge and your clinical knowledge and theoretical knowledge, and then decide which one is the best option. Always also apply the elimination technique that will help you to get the correct answer. So in this situation the correct answer is option C, occiput anterior. The rationale is occiput anterior position allow easiest passage through the birth canal. Question number 3. The first sign of effective breastfeeding in newborn is. Read the 4 options, which is these options are here on your screen. If you need more time, you can pause the video for more time. These questions are high-yield questions which are related to NCLEX, Prometric, CBT, DHA, MOH, SNLE, or other Prometric licensing exam, other your nursing board exam. So, and the main aim is to assess you for the preparation of these exams, so then you can pass these exams easily. In this question, for this question, the correct answer is option C, adequate wet diapers. The rationale is 6 to 8 wet diapers per day indicate good hydration and effective breastfeeding. Let's move to question number 4. Which is the most reliable sign of pregnancy? Most important question. Read carefully, and I will also love if you will share your comment in the comment section. Either you are able to give the answer correctly for this question or not. So please share in the comments that you was able to give the answer correctly for this question or no. The correct answer for this question is option B, fetal heartbeat. The rationale is fetal heart tone are a positive definitive sign of pregnancy. Let's move to question number 5. The recommended position for a pregnant woman experience Vena Cava compression is. Again, the most important question for the exam. Why I say the most important question? Because we prepare the candidate for these exams for more than 10 years and we get the feedback from the candidate. Okay, and they report these questions regularly in the exam. So if you will focus more on the question which we will tell you, so definitely these questions will help you. And how you will give us also feedback, just mention that which exam you are going to give, and when you attempt the exam in such a kind of question if you will see, so please let us know. And also like, subscribe our channel so you will get the notification once we upload the new video related to your profession. Thanks. For this scenario, the correct answer is left lateral. The rationale is left lateral position improve venous return and cardiac output. Question number 6. Which newborn reflex occur when the infant cheek is touched? When the infant cheek is touched, so which reflexes occur? Again, I will say most important question for the exam. Read carefully, select your best choice, and share in the comment section whether you was able to give the answer correctly for this question or not. If not, no need to worry. Just go for your book, read out about these reflexes, and you will get knowledge. And next time, come to this video, watch this video time and again. So these questions will repeatedly come into the exam, and then you will able to answer these questions correctly. In this situation, the correct answer is rooting reflex. The rationale is the infant turns head towards stimulus to prepare for feeding. Question number 7. A postpartum woman with a heavy bleeding in a bogey uterus like his. Again, most important question. Read carefully, select your best choice, and share in the comment section whether you was able to give the answer correctly for this question. In this situation, the correct answer is option A, uterine atony. The rationale is a soft uterus that fails to contract is the most common cause of postpartum hemorrhage. Question number 8. Which is the first step when assisting with a neonatal resuscitation? Pause the video for 5 to 10 seconds, read each option, select your best choice, and then compare the best choice with the correct answer which we will give to you. The situation, the correct answer is option C, warm and dry the newborn. The rationale is thermal regulation is the priority in newborn resuscitation. Question number 9. Which vitamin prevents neural tube defects? Again, I will say most important question for the exam. Either you are going to give the NCLEX exam, Prometric exam, CBT exam, DHA, MOH, DOH, HAD, Oman Medical Specialty Board exam, or Saudi Nursing Licensing exam. These are the most important questions you will definitely see in your exam day. So in this situation, the correct answer is option B, folic acid. The rationale is folic acid supplementation reduces risk of spinal bifida in encephaly. Question number 10. What is the normal fetal heart rate? Again, I will say most important question for the exam. Read carefully if you are able to give the correct answer for this question, so please share in the comment section. For this question, I will give you the correct answer, which is option C, 110 to 160 beat per minute. The rationale is this is the standard expected baseline for fetal well-being. Question number 11. Please share your score out of 10 in the comment section. Which condition is indicated by a high blood pressure and proteinuria during pregnancy? Again, the most important question related to maternity and child nursing for the exam point of view. Either it's NCLEX, CBT, Prometric, DHA, MOH, or DOH, or other nursing board exam. Please don't forget to like and subscribe our YouTube channel so you will get the notification if you press the bell icon which is on your screen. So once we upload another test, we will produce series of tests in the main Purpose of these tests are to prepare you for your upcoming licensing exam. In this scenario, the correct option is option B, preeclampsia. The rationale is preeclampsia is equal to hypertension plus proteinuria after 20 weeks. Question number 12. Which is the priority assessment for a woman with a placenta previa? The most important question again for the exam. Either it's NCLEX, Prometric, CBT, DOH, MOH, SNLE or other nursing board exam. Read carefully. Also share in the comment section whether you was able to give the answer correctly for this question or not. In this scenario, the correct answer is option D, vaginal bleeding. And the rationale is painless vaginal bleeding is the hallmark of placenta previa. Read about placenta previa, what is placenta previa, and then you will be able to answer this type of question. Let's move to the next question. Sorry, I already. So here is the next question. Which sign suggests true labor? Again, I will say most important question. True labor and false labor. These are two terms which you will see regularly in the exam question. So read carefully, select your best choice, and if possible, please comment if you was able to give the answer correctly for this question or not. So in this situation, the correct answer is option C, contraction gets stronger. True labor, strong regular contraction, and cervical dilation. These are the characteristics of true labor. Question number 14. Which is the priority for a newborn with a Meconium strain amniotic fluid? Read the four options carefully and choose your best choice. Which you think is the best one. We'll bring these four options down so you can see clearly on your screen. In this situation, the correct answer is option B, airway clearance. The rationale is risk of aspiration can lead to air. That's why we always look for the airway first. Question number 15. This is what is the common danger sign during the first trimester? Pause the video for 5 to 10 seconds. Read each option. The tip is apply your clinical and theoretical knowledge and then decide which option is the best option. If you are able to give the answer correctly, well and good. If no need to get stressed. Go and open your book. Okay, the Soundress books I will prefer is the best book for the preparation of the nursing exam. So read it about about this and then come to the video again and again, watch the video and get knowledge from these questions which we want to share with you. As I told you, we have more than 10-year experience to help the candidate for pass the NCLEX, CBT, MOH, DHA, Prometric or other nursing board exam. So in this situation, the correct answer is option C, vaginal bleeding. The rationale is bleeding early in pregnancy may indicate ectopic pregnancy or miscarriage. Let's move to the next question. Question number 16. Which condition is likely if the amniotic fluid is greenish? Read the four options carefully. Pause the video for 5 to 10 seconds and then I will share the correct answer with you. In this situation, the correct answer is option C, fetal distress, and the rationale is green or Meconium strain amniotic fluid indicate fetal stress or hypoxia, which is a sign of fetal distress. Question number 17. Which finding suggests dehydration in a newborn? Pause the video for 5 to 10 seconds. and don't forget to like and subscribe our YouTube channel so you will get the notification next time when we upload the next series of practice test. And our aim is to prepare you for the upcoming NCLEX, Prometric, CBT, DHA, MOH and other nursing board exam. This situation, the correct answer is option C, sunken pontil. The rationale is a sunken anterior pontilla. Pontil is early clinical sign of a newborn dehydration. Question number 18, which bring it down so you can easily see here. Which part of the umbilical cord carries oxygenated blood? Again, most important question for the exam. Read carefully, select your best choice, and then I will give you the correct answer. In this scenario, the correct answer is option C, umbilical vein. The rationale is the umbilical vein carries oxygen-rich blood from the placenta to the fetus, while arteries carry deoxygenated blood back to the placenta. Always read the rationale for each question and do not skip the video because you will miss the most important information which we share with you. Next question is question number 19. Which nursing diagnosis is most appropriate for preeclampsia? Read each option carefully, select your best choice, and then I will give you the correct answer for this question. And for this question, the correct option is option A, risk for injury or seizure. Preeclampsia can progress to eclampsia, so the priority nursing diagnosis is risk for seizure or an injury. Question number 20. Which is the earliest sign of hypovolemic shock after delivery? Pause the video for 5 to 10 seconds. Read the option carefully and select your best choice. Don't forget, here in this practice test, we cover different topics like labor and delivery, pregnancy assessment, newborn care, maternal complication, fetal monitoring, lactation and obstetric emergencies. These are the topics which cover in these questions, and you can also read out about these topics after when you finish to to watch this practice test, because these are most important topics. If you need the basic idea, if you know the basic idea, so definitely you will be able to answer this question correctly. So for this question, the correct answer is option C, restlessness. The rationale is restlessness is the earliest clinical indicator of hypovolemic shock due to reduced cerebral perfusion. Question number 21. Which method best confirm rupture of membrane? Read the 4 options and then I will give you the correct answer. The correct answer for this question is option B, nitrogen test. The nitrogen test detects alkaline amniotic fluid confirming rupture of membrane. Question number 22. Which fetal assessment is done using Leafold maneuver? Leafold maneuver is also one of the most important maneuver in maternity and child nursing, so read out about this one and get knowledge about this Leafold maneuvers. So in case if you will get any question in the exam, so you will definitely get the right answer. This question, the correct answer is fetal position, and the rationale is Leafold maneuver determine fetal lie, presentation and position. And see, we also give you the rationale. So this is the Leafold maneuver. Even we give you the most important terminology in most important topics, the knowledge about those topics. So see the way these videos are most important for your exam, you can imagine. Question number 23. Which complication is most likely in postpartum pregnancy? Again, see the postpartum pregnancy and complication. These are the keywords in the question. Read each option carefully, and for this question, the correct answer is option A, fetal distress. The rationale is postpartum pregnancy can cause placental insufficiency leading to fetal hypoxia and distress. Question number 24. Which newborn assessment is done immediately after birth? I will say most important question again for the maternity and child nursing module of the nursing. So for this question, the correct answer is option A, Apgar score. And again, what's Apgar score do? The Apgar score is assessed at 1 to 5 minutes to evaluate newborn adaptation to extrauterine life. So Apgar score is also another most important topic you can read for your exam, whether you are preparing for NCLEX, CBT, Prometric, DHA, MOH, HAD, SNLE, Oman Prometric, Qatar Prometric, or Kuwait licensing exam. Which condition involve implantation outside the uterus? Read the option carefully, and then I'm going to give you the correct answer. The correct answer for this question is option A, ectopic pregnancy. The rationale is ectopic pregnancy occurs when the fertilized ovum implant outside the uterine cavity, usually in the fallopian tube. Question number 26. Which finding suggests placental separation after delivery? Read the 4 options carefully, and then I'm going to give you the correct option. So the correct answer for this question is option C, lengthening of the cord. The rationale is the placenta separates, the umbilical cord appears longer, indicate placental detachment. Question number 27. Which is the best indicator of fetal well-being during labor? Most important question again for the exam. Either you are preparing for NCLEX, Prometric, CBT, DHA, MOH, HAD, SNLE, Oman Prometric exam, Qatar Prometric licensing exam, or Kuwait nursing licensing exam. Correct answer for this question is option D, fetal heart rate pattern. The rationale is continuous fetal heart rate monitoring is the most reliable method to assess fetal oxygenation. Question number 28. Which neonatal condition causes yellowing of the skin and eyes? Read the 4 options carefully and then compare your selection with the correct answer which I will give to you, and for this scenario the correct answer is option A, jaundice. The rationale is hyperbilirubinemia is a newborn leads to yellow discoloration of skin and sclera known as jaundice. Question number 29. Which newborn reflex help with feeding? Almost we done this question. So I hope you will definitely give answer to this question right now. So the correct answer for this question is option C, rooting reflex. What is rooting reflex? Again, we give you in the rationale that rooting reflex allows the newborn to turn toward the nipple and initiate feeding. Question number 30. Which drug is commonly given to induce labor? Again, the last question and the most important question for this practice test 1. So read each option carefully, and if you didn't subscribe our YouTube channel. So I will request to you to like and subscribe our YouTube channel. So it gives us a motivation. In this way, we know that you like this type of question, and these questions help you for your preparation for the upcoming NCLEX CBT Prometric DHA MOH Had Oman Prometric exam. Qatar Prometric exam and Kuwait licensing exam are your other nursing board exam preparation. So we will produce more questions for you, and our aim is so you get prepared yourself for these all exams and pass your exams, start your new career in these countries. In this way, you will get success. So the correct question for this answer is oxytocin, and the rationale is oxytocin stimulates uterine contraction and is the drug of choice for the labor induction. Thank you so much for watching this video. As you see on the screen, Dubai Healthcare Consultancy assists doctors, nurses, pharmacists, and allied healthcare professionals for license registration, data flow verification, license exam booking, and we will also give you some most important exam material if you will contact to us on our WhatsApp number which is on your screen. So we have our own website, we have question banks for all these exams, so you can get the subscription. You can contact me on the number which is on your screen if you are struggling on the subscription, because once you will get the subscription there are more exam question, around 2500 or 3000 question, and these are all exam related question. So these question will definitely help you for your upcoming Prometric CBT and NCLEX DHA MOH Had Oman Prometric, Qatar Prometric, and Kuwait Prometric licensing exam, or even your local nursing board exam. So you can feel free to contact us anytime you want. You need any help, so we are here to help you. Please like and subscribe our YouTube channel to get the update once we upload the next practice test, and don't forget to share your score in the comment section. I will waiting to see your score, and also tell me which exam you are going to prepare for. If you need any help regarding exam preparation, please leave in the comment section and I will come back to you shortly. Thank you so much for watching the video. Please don't forget to share with your friends who are aiming to prepare for all these exams. And thank you so much. Have a nice day. Bye.